is अथा तो दृष्टिगतरोगप्रतिषेधं व्याख्यास्यामः यथोवाच भगवान् धन्वन्तरिः त्रयः साध्याः त्रयो असाध्याः याप्याः षट् भवन्ति तत्र एकस्य प्रतीकारः कीर्तितो धूमदर्शिनः now among the Drishtidoshas three are sadhya, 3 are asadhya and 6 are yapya vyadhi, and the dhoomadarshi treatment is mentioned in the beginning. Drishto pitta vidagdhayam kapena cha pitta shleshmaharam kuryad vidhim shastrakshataa date nasya seka anjana alepa putapakhi sadarpanihi adi tu traipalam peyam sarpi traivitamuttare tailvakam cha ubhayoh patyam kevalam jeernameva. In the case of dhoomadarshi, that's optic retinitis conditions. In case of pitta vidagdha, if there is a pitta lakshana, then or kapha lakshana, specific to the treatment, like specific to the doshas, pitta and the kapha vyadhi hara aushadhis have to be used in the form of nasya, seka, anjana, alepa, putapaka or tarpada, so on. The different protocols could be done, and tripala ghata has to be given in the beginning, and trayurta sneha has to be given in the later part of the treatment. Kubjaka ashoka shala amra priyangu nalina utpalehi pushpaihi harenu krishnahva patya amalaka sanyutehi sarpihi madhuyitehi churnehi venu nadyam avastitehi anjayet dvavibhishaka pitta shleshma vibhavito. The anjana has to be prepared with these drugs, kubjaka, ashoka, etc., which has to be prepared in a venunadi, a bamboo, and kept stored there in the form of an anjana, and that anjana has to be used in pitta and kaphaja dhoomadarshi conditions. Rasanjana rasak shodra talisha swarna gairakam goshakrit rasasanyuktam pittopahara drishtaye. In case of the pitta lakshana conditions, Rasanjana rasa kshaudra and goshakrit rasa, cow dung's juice, all these have to be put together in the form of anjana. Or shitam savirakam vapi pishtva atharasa bhavitam kurmavittena pitmatiman bhavayed rohitena va churnanjanam vidam nityam prayujyam pittashante. Another of the anjana yoga mentioned for pitta vyadhi is saviraka and rasa as such, and kurmapitta rasa, the tortoise bile juice has to be used. Very awkward this preparation like. Then Kashmiri pushpa madhuka darvi rodhrasanjanihim sakshaudram anjanam tadvada hitam atra amaya sada. Another of the anjana yoga along with the kshaudra where pittahara Kashmiri pushpa madhuka etc. are used. Srojajam saindhavam krishnam renukam chapipeshayat ajamutrena avartya kshanada andhyanjane hitaha. Another of the anjana yoga where shilajitu saindhava krishna have to eat that pipali and renuka has to be used along with the urine of the goat. Kalana sarivam krishnam nagaram madhukam tatam talishapatram kshanade गांगेयम एकत्रसे कृताहताः वर्तय पिष्टाः छाया शुष्काः शुकावहाः. Another of the varti which can be used, that varti is collyrium which can be applied in the form of an anjana only with the kalan sariva krishna shunthi talishpatra and gangeyer ekritrasa, that the juice of the liver of animals which are present in the Ganga river. Manashila, Abhaya, Vyosha, Bala, Kala, Sarivaha, Sapena, Vartayat, Pishtaha, Chaka, Kshirasamanilaha. Another of the Varti Yoga where Manashila, Abhaya, etc. used. Then Gomutra, Pitta, Madira, Yakrit, Dhatri, Rase Pachet, Kshudranjanam, Rasena, Anyad, Yakritaha, Taipalai Piva, Gomutra, Adya, Arnavamala, Pippali, Kshaudra Katfale, he signed the Vopahitam, Jinjatanihitam, Venugahvare. Another of the yoga where again Yakrit, that the liver extract as well as Arnavamala, that's the residue from the sea, and Gomutra, etc., along with the other drugs. Even Madira, alcoholic preparations are also added to such a yoga is mentioned. Medo Yakrit Dhrudam Chajam Pippalyaha Saindavam Madhu रसम् आमलकाच्चापि पक्वं सम्यक् निधापयेत् कोशे निर्माणे तद्वत् क्षुद्राञ्जनं हितम्. Another of the क्षुद्राञ्जना where goat's liver along with the pipparies and the etc. are used. Now, as far as retinopathy is now concerned, Dhumadarshi, the clinical symptoms are very much the same as that of the retinopathy. In the present day's approach of retinopathy, we categorize retinopathy into two categories: proliferative and non-proliferative. Proliferative retinopathy is the advanced stage which can result in blindness, whereas non-proliferative retinopathy is in the early stage, and majority of the conditions retinopathy, the causes are diabetic retinopathy is the most common type of the retinopathy which we see, and non-proliferative retinopathy doesn't affect the vision directly, whereas it reaches the proliferative, it can lead to complications like glaucoma or a complete loss of vision as such, where there could be increased number of new vessels over there. With the fundoscopy, the difference can be made out. In a proliferative, when the retinopathy starts, it starts with the initial edema, macular edema, and then it results in the bleeding over there, leaked blood hemorrhages. In a non-proliferative retinopathy, only the spots of blood are seen under fundoscopy. In the proliferative retinopathy, you can see the new blood vessels, number of blood vessels may be increased, and at this stage the patient's vision will be affected seriously, and that can result in the other complications like glaucoma-like conditions. Of course, there are 4 stages as such in the diabetic, particularly diabetic retinopathy. There are 4 stages like mild, moderate, and severe. This proliferative diabetic retinopathy, and this diagnosis is made based upon the fundoscopy findings. When in the fundoscopy you find this coagulum, white yellowish color coagulum over the area, maybe with the fine detachment of the retina, that's considered as a severe retinopathy. Now, in the present day situation, the treatment protocol is the mainstay of the treatment is glucose control is the mainstay of the diabetic retinopathy, particularly in diabetic retinopathy. In other conditions, of course, the protocol is mainly interventional, but laser surgery is supposed to be one of the ideal remedy in the early stages, and it can prevent the vision loss from 30% to 15% over a 3-year period. See, retinopathy is a progressive condition, and if it is treated, laser surgery is done in the non-proliferative stage. Proliferative stage can be avoided or postponed by a prolonged period with the laser surgery. This is a standard protocol of the treatment now. The other protocols which are done are the targeted drugs like ranibizumab or triamcinolone, which are also immunosuppressant drugs, also show substantial improvement in 50% of the patients. And or the other is intravitreal injections of hyaluronidase also is another of the option of the treatment to clear the hemorrhage spots. As far as our routine clinical practice, what I would suggest is in the patients of diabetes mellitus, if they have retinopathy signs, one of the preventive measures which I would suggest is Triphala with the Madhu and Sarpi at night, which can give you somewhat a better satisfactory outcome, in the sense the complications can be postponed. I don't say that it can be reversed, but the complications can be postponed in the retinopathy, a simpler treatment. So that's about one of the conditions, Dhumadarshi. Next of the condition which is suggested is by Srushali is Naktandhya or night blindness. Now, in the night blindness, the very interesting issue is about the suggested treatment. Vipachya godhaya krita ardhapatitam supuritam aghadikabhiragneena nishevitam tadyakratanjanena nihanti naktandhyam asanshayam khalu. In the naktandhya, one of the treatment is lizard's liver is split into 2, and the pippali churna is filled in, and then it is heated in fire, and that anjana is done, prepared with that, and that anjana is one of the remedies in case of naktandhya, night blindness conditions. Similarly, yakrachhagabhavam hutashine vipatya samyak magadhasamanvidam प्रायोजितं पूर्ववद् आशु असंशयं जयेत क्षपान्ध्यं सकलञ्जनात् नृणाम्. Another Patanjana where the goat's liver is processed in the same manner with the same pipali churna, and then it is heated, a sort of preparation which can be used in the form of anjana. प्लीहा यकृच्चापि उपभक्षिते उभे प्रकल्प शूल्ये घृततैल संयुते ते सार्षप स्नेह समाहिते अंजनम नक्तान्यम आश्वेव हत प्रयोजिते. Yogurt and liver also has to be consumed along with the ghrita and taila, or with the sarshapa sneha. Also, it can also be used as a anjana. Nadija shimbi trikatunya atha anjanam manashiladve nishe ekat bhavan सचंदनेयम गुटिका अथवा अंजनम प्रशस्ते by divaseshu apashyatam. Now those who have a tendency to have the blindness even in the daytime, it's a night blindness is one, daytime blindness also can occur in some of the patients, and in such conditions one of the yoga mentioned is again yakrit is one of the major content, and then along with the other plants. Now as far as the night blindness is concerned, from the current point of view, patients who have the night blindness, causes could be either early stage of the cataract. It also can be seen in glaucoma. Cataract and in the glaucoma conditions, the patient needs better light, more light for the seeing. The patient's sensitive visual acuity in a relatively low intensity light would be affected, and hence the patient may have a tendency to complain of night blindness. The other conditions like retinitis pigmentosa and vitamin A deficiency are the other common causes. As far as in the general issue is concerned, the moment you speak of night blindness, the issue which comes to your mind would be vitamin deficiency. Vitamin A deficiency is supposed to be one of the most important causes for the night blindness seen in otherwise healthy patients, and usually in the younger age. And night blindness is also named as nyctalopia. Now, as far as vitamin A deficiency is concerned, the typical symptoms would be abnormal visual adaptation to darkness. That's the typical features of vitamin deficiency. Patients to visualize in the darkness, the pupils have to be dilated, and that low intensity light has to produce the image. In the patients who have vitamin A deficiency, this adaptation mechanism would be either very much delayed or it doesn't occur, and hence the patient would have a difficulty in vision. Along with that, the other clinical symptoms are respiratory and diarrheal infections, growth rate is reduced in children, bone development also is slowed down, dry skin, dry hair, broken fingernails, decreased resistance to infections are the other clinical symptoms of vitamin A deficiency. And the daily requirement of vitamin A in infants is around 375 mg, whereas in females older than 10 years it's around 800 micrograms, and in males it's around 1000 micrograms per day. That's about the daily requirement, and the usual protocol is vitamin A supplement. When it comes to the question of vitamin A supplement, the most important source of the vitamin A is the liver of animals, and very interestingly, Sushruta has used the liver as one of the most common prescription in the conditions of Naktandhya. So, though Sushruta might not have mentioned about vitamin A and such a components, the fact that Naktandhya or night blindness can be managed with the administration of liver extract of different animals in different forms is a most important issue which is mentioned by Sushruta. Now anyway, that's about another of the condition. Then the other is yapya conditions. Bhavanti yapya kalu yesh ramayaha hare nasukreshu siravi mokshanihim virecha ityapi puran sarpisha virecha angopahitena sarvada. The other yapya vyadhis of the drishti, like timira stages, different stages of the timira, which are considered as yapya, as there is no question of complete cure. The better option of the treatment would be, or prevention of progression of the disease would be Rakta Mokshana and Virechana with the Purana Sarpi. Then Payo Mishram Pavanodhave Hitam Udanti Panchangula Tailamevatum Bhavet Gritam Traifalamema Shodhanam Visheshada Shonisa Pittaroga Yoho Pitta Trivad Virekha Kavaja Prashastide. Tridoshide Tailam Sanchitat Kradam. In case of Vataja Vyadhi, Vataja Timira conditions, the Panchangula Taila or Trifala Grita, Trivalta Grita is Trifala Grita is given. In Shoniza Pitta, Rakta Pitta Vyadhi, Trivurti is used for Virachana. In Kaphaja Vyadhi, Trivurtaila is used for the Virachana. Purana Sarpihi Timreshu Sarvasho Hitam Bhaved Ayasa Bhajana Sthidam Hitam Cha Vidya Trifala Kritam Sada Kritam Yad Mesha Vishana Nama Bhihi Purana Krita, old stored ghee in a iron vessel, or Trifala Krita stored in horns of goats also is used as one of the remedies. Sada Avalishyat Trifalam Suturnitam Grza Pragadam Timire Athapittaje Samiraje Tailayutam Kapatmake Madhu Pragadam Vizita Yukchitaha. Now, another of the option in case of the Timira, particularly the Pittaja Timira and Kaphaja Timira is a Trifala Churna with the Grita, or in case of Pittaja with the Grita, and in Kapaja with the Madhu. Trifala Churna has to be given. Gavam Shakas Kwata Vipakkum Uttamam Hitam Salem Timiration Amanam. A Nastya with the Go Shakrata, that's a cow dung juice Taila prepared, is another of the option. Hitam Grisam Kevalam Eva Paitike, he Ajabikam Yan Mudhri Hipipacham. Aja Abika Grita, that is goats and sheep Grita, with the Madhura Dravya also is one of the option. Tailam Sirado Mudhrecha Yadgane Yatha Anutailam Pavana Asruthayo. Anutaila also can be given in the form of Nasya. Saha Ashwagandha Atibala Bala Varishtatam Hitam Chanasya Tirutam Yadiritam Jalodbhava Anupaja Mamsa Sanskrutata Grisam Vidhayam Peso Isutitam. Another of the yoga where the Mamsarasa of these Anupa animals are used. Sasaindavaha Kravya Bhukoyana Mamsayoho Kravya Bhuku Yena Mamsayoho Hitaha Susarpihim Samadhu Putakvayaha. The another yoga where flesh of eagles or yena, that's the rabbits, they are used for the in the form of Putapaka. Vasa ata grudha uraga tamra chudajaha tada prashastaha madhukanvitanjane. Another of danjana where again eagle's flesh with the snake's flesh also is used, and this cock's flesh also is used, chicken. Pratyanjanam srodasi yatsamukchidam kramagrasa kshiraghadeshva vidam. The another of the Pratyanjana yoga is used. Stitam dashaha trayameta danjanam Krishna uragasye kusha sampravishthate tan malati koraka saindhavayitam tadanjanam syati mire atharagini subhavitam va paisarvinatrayam kachapaham shastra vidha pratyakshate. In the pigmentary disorder of the lens, where the eye becomes reddish, the lens becomes reddish, in such conditions Krishna uragasya kusha sampravishthate, that's the that poison of black snake, Krishna Sarpa, has to be collected and it has to be processed in the form of Anjana as such. Then Habihi idam Shirabhavam tu Paitike Vadanti Nasye Madhuraushrihi Kritam Tattarpane Chaiva Hitam Prayojitam Sajandalas Yeshu Cha Putakvayaha. Another of the Putapaka with them Kshirabhavam Habihi, that's the ghee out of milk without making it curd. Non-fermented milk ghee is prepared, and that has been given in the Madhuraushri in case of Pittaja Vyadhi. Rasanjana Kshodra Sita Manashilaha Kshudranjanam Tanmudhakena Sanyutam. Another of the yoga Shudranjana, where Rasanjana Kshodra Sita are added. Another of the yoga is Samanjana. Samanjana Ma Karakarodbhavam Sujurnitam Seshtam Shantitat Vijaha. Then Bhillota Gandhodaka Sega Sevitam Pratyanjane Chatra Hitam Chupstakam. Another of the yoga is Pratyanjana, and another of the yoga is Jalanjana. Jalanjana is Sameshasanga Anjana Bhagasamitam Jalodbhavam Kachamalam Yapohati. So different varieties of the Anjana are used in case of the Kacha, that's the cataract conditions. पलाशरोहितमधुकजाः रसाः क्षौद्रेण युक्ताः मदिरा अग्रमिश्रिताः उशीरलोध्रा त्रिफला प्रियंगुभिः पचेत्तु नस्यं कफरोपशान्तये. In the kafaja involvement, the nasya of these drugs are used. Then Vidanga Patha Kinihi Ingudi Twajaha Prayojayat Dhumam Ushira Sanyutaha Naspati Kwadha Vipachitam Gusam Hidam Haridra Nalabeta Tarpadam. Another of the Tarpada Yoga which can be used in case of the Kafaja Vyadhi, Kafaja Timira. Now, as far as Pittaja Kafaja Timira, they are the different stages of the cataract as we see. Samagado Makshika Sindhavadyaha Sajangala Hasya Putapaka Evaja Manashila Trushan Shankamakshike his Sindhu Kasis Rasanjani Kriyaha Hiteja Kasis Rasanjanatra Pache Budanagari Yute, another of the yoga which is used. Yadanjanam va bhusho nishechitam samutra vargyate palodakeshtate nishachara asti sthitam etadanjanam shipecha masam sarire asthire punaha meshasya pushpaihi madhukena sanyutam tadanjanam sarvakrite prayajeta. Another of the Anjana yoga where the snake's bones are used for the preparation. Kriyascha sarvaha kshatrajodbhave hitaha kramaha parimlayini chapi pittahata क्रमो हितः स्यन्दहर प्रयोजितः समीक्ष दोषेषु यथास्वमेव परिम्लायि व्याधि where there will be pigmentary changes in the eyes and results in glaucoma. The treatment is suggested as in case of the raktaja this cataract like doshodaye naimacha viplajingate dravyani nasyadishu yoje pudah पुनश्च कल्पयेत् अंजन विस्तार शुभः प्रवक्ष्यते अन्यः तमपीह योजयेत्. All the anjana yogas which are mentioned earlier in the form of nasya can be used. Kritam Puranam Tripalam Jatavarim Patolam Mudgamalakam Yavanapi Nisheva Manasya Narasya Yatnato Bhayam Sughorati Miladna Vidyate. A Purana Krita with Tripala Shatavari Patola, these have to be consumed regularly. Such a person would never have a timira. Cataract can be prevented with the diet. That's the important thing. Shatavari payasa eva kebalaha tatha kruto va amalakeshu payasaha prabhuta sarpik tripalodakottaro yavodano va timiram yapohati. Shatavari payasa or amalaki payasa with sufficient ghee and tripalakvata also can prevent the timira. Now, as far as the Parimlayi condition is concerned, or the early stages of the Kachat, what we consider as a Pitta Vidagna Drishti or Kapha Vidagna Drishti, the Yapya Vyadhi mentioned by Sushruta, they could be either optic neuritis or maybe the different stages of the cataract. And the optic neuritis is one of the other common condition. Next to cataract is the next common condition which can result in vision loss. And it's a demyelinating inflammation of the optic nerve and often is associated with the multiple sclerosis or neuromyelitis optica. The common triggering factors which produce optic neuritis are patients who have a presiding viral illness, some other viral fever, including COVID. Increase in the optic neuritis incidence are more. Then the clinical presentation is a rapidly developing impairment of vision in one eye or less commonly in both eyes. Then dyschromatopsia, that's a change in the color perception in the affected eye which is more prominent than the decreased vision. Then retroorbital or ocular pain is the other symptoms which can occur. And the Untaf phenomena, that's where the patient may have symptoms which are exacerbated by heat or exercise. Then full-fledged effect where a straight line appears to have curved trajectory. I will show you the image like. And typically in optic neuritis, it begins to improve after one to several weeks after onset, even without any treatment. Permanent residual deficit in color vision and contrast can occur as such, though the vision may be recovering as such. What we see as full-fledged effect is a object which is moving in the straight line would be perceived as if it is moving in a curved fashion. That's full-fledged effect, which is another the clinical evidence of optic neuritis. Now, the treatment protocol now is there is no curative treatment. The disease-modifying drug like eculizumab a monoclonal antibody is the first drug specified by the USA Food Drug Administration in the optic neuritis. And often it can result in full-fledged multiple sclerosis. So when we treat the patient, it will be on the same lines of multiple sclerosis as such. But as far as a definite outcome, I don't know. I can't say like whether we can really produce a change or not, but we treat the same on lines of the multiple sclerosis. Then comes the next issue, the cataract issue. Jivanta shakam sunnishannakam satangaliyam varavastukancha chilli tatha mulaka potika cha drishtihitam shakuna jangalam cha पटोल कर्कोटक कारवेल वार्ताक तरकारी कजीरजानि शाकानि शिग्रू वार्तकलानि चैव हितानि दृष्टेः कृतसाधितानि. The other substances, food substances which can help in improving the vision, which are supportive for the vision, are जीवंत शाखा सुनिश्चित तंडुलिया etc. These are used as such. विवर्जयेत् शिरामोक्षं तिमिरे रागमागते यंत्रेण उत्पीडितो दोषो निहन्यात् आशुदर्शनम्. Now next is timira, where the cataract has fully developed, and the cataract again could be either pigmented or non-pigmented. Now in the pigmentary pathologies, Sushruta suggests Siramokshana should not be done. Siramokshana in such conditions can result in a rapid progression of the disease and handling of the reddish colored cataract, pigmented cataract should be avoided. Aragi, if there is no color in such conditions, Aragi timiram satyam adyam patalamashram kritshe ditiye ragisyad tritiye yapyam jade. If there is no color or change or no pigmentary deposit in the cataract, then in the lens, if it is in the early stages, the first patala or ditiya patala, it can be cured. In the first patala it is sadhya, ditiya patala kritsha, and the tritiya patala is yapya if it becomes raga. Raga prapteshu hitaha timireshitat kriyaha yapanartham yathodishtaha sebhyashchapi jalokasaha. Even in case of raga prapta conditions, that there is a pigmentary changes, like when I say raga prapta which has become somewhat opaque, in such conditions for the yapana, to prolong the course, the same protocol of the treatment could be considered. From the current point of view, we consider that stage as the pigmentary dispersion syndrome or pigmentary glaucoma, which are characterized by the loss of pigment in the posterior surface of the iris and excessive pigment released throughout the anterior segment of the eye. Because it is on the anterior segment of the eye, it looks like as if the lens is pigmented. And in such conditions, intraocular pressure and in pigment dispersion syndrome and pigmentary glaucoma is subject to large fluctuations. Unlike that of the typical glaucoma, the pressure need not be constantly raised. The problem would be, complications would be, it's a progressive condition which results in a glaucomatous pathology and complete vision loss. There is no curative treatment now. All the other options of the treatment now is either induce meiosis with the adrenergic drugs, or iridectomy with the laser, or trabecoplasty with the laser as is the treatment. The presentation of a pigmentary pathology could be of different varieties. When you look at the eyes, you can see this pigmentary distribution in different manners, and the standard these types of pigmentary deposition seen are either radial, where you will see these lines of pigment deposition, or Krukenberg's spindle, where over the iris you will see these depositions in the form of spindles, or pigmentary in the anterior surface of the iris, where you will see the whole iris having that whitish color, or it could be on the lens surface. When it is on the lens surface with a split like lamp, you can make out that deposition. Anyway, that's about one of the stages which may be the triggering factor for the next stage of the cataract or complete loss of vision. Then comes the real cataract condition and the surgery suggested by Sushruta. Shlaishmike linganasheto karma yat pakshami siddhe nachayad ardhendu dhakarmambu bindu muktakritihi stiraha vishamo va tanur madhye radimanva bhuprabha drishisto rakshite dosha sarojo vasalohitaha. In a full-fledged cataract condition, Sushruta suggests about the surgical treatment, and the full-fledged cataract may have the shape being altered, either it may become bulged on one surface, that is ardhendu, or it may be a tear shape, like or water drop like shape, that dharmambu bindu, or muktakriti, or it may become spherical and it becomes harder. So when the lens becomes harder or the shape is altered, then it's a sign of cataract which requires surgical intervention. And the surface is irregular, or when it becomes thin in the middle, also or when it becomes pigmented, that's an indication for the surgery according to Sushruta. And the technique of surgery mentioned by Sushruta is snigdha sinnasyatra kale natyushna shikare yantritasya upavistasya swam nasam pasharat saman matiman shukla bhagavdo kristan muktva hyapangadaha unmilya nayane samyak sirajala vivarjite न अधो नोर्ध्वं न पार्श्वाभ्यं छिद्रे दैवकृते ततः शलाकया प्रयत्नेन विश्वस्तं व्यववक्त्रया मध्यप्रदेशिनी अङ्गुष्ठस्थिरहस्तगृहीतया दक्षिणेन भिषक्सम्यं विध्येत् सव्येतरत् वारिबिन्द्वागमः सम्यक् भवेत् शब्दः तथाप्यथे द puncturing at the exact level of the junction of the iris with the sclera, which is called as Daivakrita Chidra, and at that point the puncturing has to be done to reach to the chamber, anterior chamber, and the lens as such. And this provision is done, this can be done by making the patient sit and asking the patient to look at his tip of the nose, so that the eyeball will be medially rotated, and on the lateral part you have to make a small incision, and the eyeballs have to be kept steady and incision has to be done. The evidence of the proper location of the incision would be there will be not much of a bleeding, but a drop of water, clear fluid may come out along with some sound. Then once this has been reached, samsitya viddhamatam tu yoshis sanjena kovidah sthire doshe televapi svedev akshibhachyatah सम्यक् शलाकां संस्थाप्य भृङ्गैः अनिलनाशनैः शलाकाग्रेण ततो निर्लिखेत् दृष्टिमण्डलं विध्यतो यो अन्यपार्श्वे अक्ष्णः तं रुद्ध्वा नासिकापुटम् उत्सिङ्गनेन हर्तव्यो दृष्टिमण्डलः कफः. Then once it has been punctured, the whole area has to be cleaned with breast milk and with the shalaka, specified shalaka. It has to be introduced into this lens by puncturing the outer surface, and the whole puncture has to be, or the whole lens material has to be either removed or it has to be curated, that's emulsified, because if it is thinner it can be emulsified. That's what we call as the couching surgery. That couching surgery is suggested by Sushruta as such. Then once it is done, निरभ्रैव धर्मांशु यदा दृष्टि प्रकाशते तदा असौ लिखिता सम्यक् ज्ञेया च निर्व्यथा. When it is the emulsion, Foucault emulsion is done properly, the whole lens becomes clear, looks like a sky without clouds, so that's clear, and there would be not much of a pain. एवं तो अशक्य निर्हर्तुं दोषे प्रत्यागते वा स्नेहादि उपन्यस्य वेधो भूयो विधीयते. If such a result is not achievable, then you have to treat the patient with the sneha krama, and if necessary it may have to be punctured again after a certain period of time. ततो दृष्टेषु रूपेषु शलाकान् आहरेक्षणैः घृतेन अभ्यजनेन वस्त्रपट्टेन वेष्टेत. ततो गृहे निरापादे शयित उत्कार्येव च उद्गार कासक्षवतु स्तीवन उत्कम्पनानि च तत्कालं नाचरेत् ऊर्ध्वं यन्त्रणा स्नेहपीतवत्. Now once you have cleared that the opaque lens and the patient is able to see the object, then you do a ghrita over the eye and then bandage with a vastrapatta. Patient has to be nursed in a post-operative room where there will be no contamination, no free ventilation as such, and patient has to lie in supine position, has to avoid the rigorous movements of the head like coughing, sneezing or splitting, etc. त्रहात् धावेत कषायैः अनिलापैः वायोः भयात् त्रहादूर्ध्वं स्वेदेत् अक्षिपूर्ववत्. Once in 3 days the eye have to be cleaned with the Vatagna Dravya Kashaya, and Svedana also has to be done once in 3 days. Dashaham evam sanyamya hitam drishti prasadanam paschat karma cha seveta laghvannam api matraya. After 10 days the patient may have to be treated with the drishti prasadana karmas. the protocols like Tarpana, Ashchotana may have to be done along with the Laghuana. Siraveda Vido Purum Narayeta Vivarjita, Natesham Nilikam Vidyeta, Anyatra Abhita Abhishaka. In those conditions where Siraveda is contraindicated, the surgical procedure also is contraindicated. Puryate Shonitanakshi Siraveda Visarpada, Tatrasti Stanya Yascha Pakwam Seke Hidangadam. If during Siraveda the whole eyeball becomes filled with the blood, then one of the option is the breast milk with the madhyastic pata has to be used for steka. Apanga asana vidhetu shopa shula ashuraktaraha tatra upanaham bhrumadhye kuryacha usnadisechanam. One of the complications which can occur in the couching surgery would be the improper location of the incision. If the location of incision is more towards the periphery, it can result in pain, swelling, so on. In such conditions, Upanaha has to be done over the mid forehead and Usnadisechanam, warm ghee has to be poured over the area. Vyadhena asana krishnena raga krishnascha pidiyate tatra adhashodhanam sekha sarpisharaktamokshanam. Suppose the incision is made more close to the iris, that black area. In such conditions, there would be more swelling and reddish color in the iris area. In such conditions, Virechana and Raktamokshana along with the Sarpiseka, Ghrita has to be used. Athapi Upari Vidyecha Kasta Ruk Sampravajite, Tatra Kostena Hamisha Parisheka Prashasyate. If the location of the incision is above the optimum line, then it can result in severe pain. In such condition, again, Ghrita Seka is suggested. Shula Ashuragastu Atyartham Medho Vadhena Pichilaha Shalaka Manachasravaha Tatra Purachikitsidam. If the incision has become wider than what's necessary, it can result in more discharges, and the Shalaka, that instrument, also may result in more of discharge. In such conditions, again, the same protocol of the treatment has to be followed. Ragashtu Vedana Stamba Harshascha Atibighattide Snehasvedau Hidau Tatra Hidam Chapi Anvasanam. During this procedure, if the eyeballs are mishandled or rough-handled, Atibighattide is rough-handled. In such conditions, there could be more pain, swelling, and abnormal sensations. In such conditions, again, Snehasvedana and Anvasana are suggested. Doshastu adho apagrashte api tarunas punarurdhvagaha kuryat shuklarunam netram tivrarum nastadarshanam. If during the removal couching, only the lower part is couched properly, the upper part of the lens is not couched properly, it again can result in movement of that non-emulsified substance, that thick substance over there, and it can result in the reddish discoloration of the eyeball. And in such conditions, Madhurei Tatra Siddhena Gritena Akshana Prasejaram Shirobhastvincha Senema Dadyat Mamsaishcha Bhojanam. Madhura Aushadhi Siddha Ghrita has to be used for Sechana, Shirobhasti, and even internal administration of the same has to be given. Doshastu Sanjatabalo Ghanaha Sampurna Mandalaha Prapya Nashet Sharakagram Tanu Abram Ivamardam. If the lens has become hardened, then emulsification may not be possible. In such conditions, the shalaka, that tip of the rod, would be fixed, and it becomes the lens becomes firm over the area, and that may not be easy to remove. And even if it is removed, it will be in pieces like Murdha Abhidata Vyayama Vyavaya Bhamivat Murchanehi Dosha Pratyeti Kopacha Vidho Atitarunascha Yaha. If the couching is done at an early stage, before the cataract has become mature, that means it becomes solidified, in such early intervention can result in the injury to the eyes, and there will be dosha prakopa. Shalaka karkasha shulam khara dosha pariplutam vranam vishalam stulagra tikshna himsyadane kada jalasravam tu vishama kriya sangam atha astira karoti. The shalakas, the instrument which you use for the surgery, should be of optimum size and optimum quality. If the surface of that instrument is rough, it can produce more pain. It can, if it is wider, it can result in more discharges and the wound will become bigger. it can produce more pain. As such, if the shape is not proper, it can result in more discharges of the vitreous fluid, and if it is not handled properly, if it is moving around, it can result in a improper injury, lots of collateral injuries. वर्जिताः दोषैः तस्मात् एभिर्हिता भवेत् अष्टाङ्गुलायता मध्ये सूत्रेण परिवेष्टिता अङ्गुष्ठपर्वसंहिता वक्त्रयोः मुकुलाकृतिः ताम्रायसी शातकुम्भी शलाका स्यात् अनिन्दिता. The optimum probe or rod which is used for that foco emulsion would be ashtangulayata, 8 angulas in long, and the tip should be as thick as that of the thread, and it has to have some hold at the angusta which can hold that area. Tip would be mukulakriti, tip would be pointed. It could be prepared out of copper, iron or gold, which could be used as such. रागशोफो अर्बुदम चोषो बुद्बुदम शर्कराक्षिता अधिमन्तादेश्चान्ये रोगाः स्युः व्यथदोषजाः अहिताचारतो वापि यथास्त्वं तानुपाचरेत्. As a complications of the surgery, there could be more swelling, there could be arbuda, mass formation, or budbuda, there could be bubbles formed in the sclera, or shukarakshita, shape of the eyeball would be altered, or adhimantadi diseases can occur and they have to be treated accordingly. Now, as far as the cataract is concerned, now most important, the cataract of course could be congenital or senile. Congenital cataract is another of the issue, but from the clinical point of view, the most important assessment is over the senile cataract, which is age-related vision impairing disease characterized by gradual progressive clouding and thickening of the lens of the eyes. And the National Program for Control of Blindness, as per the WHO, has shown that there is a backlog of over 22 million blind eyes in India. So, cataract surgery is as far as the surgery done now is not yet enough to treat the conditions. The cataract now is categorized into the 4 stages: incipient, immature, mature or hypermature. Now, whatever Sushruta has mentioned as the dosha vidagna drishti, they are suggestive of the same. Incipient cataract, where only on slit lamp examination it is seen but no clinical significance. Immature is by variable amount of the opacification which is present and can be seen as a low density area when you look at the eyes. Mature cataract is opaque and it can obscure the red reflex, and hence it looks like reddish or whitish as is in color. Hypermature is when it has become very dense and complete red reflex is lost, that the color could be, no color would be seen, or rather it will be totally opaque, either red or whitish in color, and it may be having irregular surface, lens may be wrinkled as such. Now, clinical staging again on the visual acuity also, another way is a clinical staging on visual acuity by looking at the how much of the vision is lost. Incipient cataract, the vision is normal. Immature cataract, the vision would be at 20 to 200, and mature cataract is 20 to 100, more than that, and hypermature would be no vision as such. The visual impression, when you use a slit lamp, the cataract also can be made out based upon its type and location. A senile mature cataract would be seen as opaque, and senile cortical is seen on the surface thick as such. Anterior polar or embryonic nuclear, depending upon the opacification. Also, it could also be classified based upon the location of the opacification, like posterior subcapsular or simple subcapsular, sunflower-like or faculatic glaucoma, or traumatic, where the trauma could be producing that irregular scarification, could be the signs. Now, as far as the surgical treatment is concerned, if you look at the Western surgery, now one of the most important source of the ophthalmic surgery, it's a very interesting issue, in that it's mentioned that in 2250 BC, the Babylonian history says that the surgery of couching was done. And in that Western source of history, Sushruta is put in 300 BC, and in ancient India, couching is suggested as a treatment. but virtually time interval of Sushruta is 5000 BC, much earlier than Babylonian history. The surgery was done, but somehow in all the Western literature, the credit goes to some other Western country, and Sushruta is put in at a later stage as such. But at least there is some casual mention of Sushruta as such. Then technology has now changed a lot. The current technology, the couching is not done. As far as the Western surgical history, the intracapsular cataract extraction was done in 1753. The real phaco emulsion, which has become which is really the procedure mentioned by Sushruta, it came into vogue and became a regular procedure is 1967. An American ophthalmologist called Charles Kellman introduced phaco emulsion as an alternative approach to that intracapsular extraction or extracapsular extraction. And the only difference is he used an ultrasound driven needle which is much smaller, thinner, and hence the injury to the eyeball would be smaller. Whereas Sushruta, the incision should be more because the rod would be thicker. In 1949, the intraocular lens was introduced, and now it's the intraocular lens which is more popular than the emulsification. Phaco emulsification now is banned. It should not be done as such as per the guideline, and because the guideline now is given in 2020 in India, particularly for cataract surgery, a document, 75 pages document about the guideline for management of cataract in India is now published, and those who do the cataract surgery should follow this now legal. And in that guideline, phaco emulsion is completely prohibited, and it should be either intraocular emulsion or lens extraction extracapsular. That's what is suggested. Now that's about the current issues in brief compared to Sushruta and the current issues. Then the last part is about the complications and other issues. Rujayam akshirageva yogan bhuyo nibodhame gairikam sarivam durvam yapapishtam ghasampayah sukhalepah prayojyoyam vedana ragashanteye मृदु भ्रष्टैः तिलैर्वापि सिद्धार्थकसमाहितैः मातृङ्गारसोपैतैः सुखालेभः तदर्थकृत पयस्य सारिवापत्रमञ्जिष्ठा मधुकैरपि अदा क्षीरान्वितैः लेपः सुखोष्णः पथ्यमुच्यते दारु पद्मकशुण्ठिभिः एवम् एव कृतोऽपि वा द्राक्षा मधुककुष्ठैर्वा तद्वत् सैन्धवसंयुतैः रौद्रसैन्धवमृद्विका मधुकैवापि अदापयः श्रुतं सेके प्रयोक्तव्यं वृजा रागनिवारणम् मधुक उत्पलकुष्ठैर्वा द्राक्षा लाक्षासितायुतैः ससैन्धवैः श्रुतं क्षीरं रुजा रागनिबर्हणं शतावै पृथक्पर्णी मुस्ला आमलकपद्मकैः सार्धक्षीरैः श्रुतं सर्पिः दाहशूलनिबर्हणं वातग्नसिद्धे पयसि सिद्धं सर्पिश्चतुर्गुणे काकोल्यादिप्रतिवापं तद्दिव्यात् सर्वकर्मसु. In the for the relief of pain and swelling, different yogas are mentioned, and these yogas could be selectively used based upon the availability. One of the most important contents, common content in majority of yoga is adapaya, that's milk of goat is one of the common issue. Shamyatyevam nache chulam sigdha sunyasya mokshayat tadasiram bhayabhapi matiman kirtam yatha. If these medicines do not relieve the pain in that condition, Siravyadha or Siradaha are considered as the options. Drishtihe अथ प्रसादार्थम् अंजने श्रुमे शुभे मेष शृंगस्य पुष्पाणि शिरीष धवयोः अपि सुमनायाश्च पुष्पाणि मुक्ता वैदूर्यमेव च अजाक्षीरेण संपिष्य ताम्बले सप्ताहम् आवपेतम् प्रविधाय च तद्वर्तीः योजेत् च अंजनेभिषक् स्रोतोजं विद्रुमं फेनं सागरस्य मनश्शिलां मरिचानि च तद्वर्तीः कारयेच्चापि पूर्ववत् दृष्टिस्थैर्यार्थम् एतत् विद्याद् अंजने हितम्. For the next improvement of the vision after the surgery, anjana are used, and the anjana could be prepared with the yogas mentioned like Meshasanga Pushpa and flowers of different plants with Ajakshira again, or the Shilajitu with that's your coral or the with coral as or sakar pen etc. The crystals could be used. भूयो क्षामुख्यानि विस्तरेण अंजनानि च कल्पे नाना प्रकाराणि तानि प्रेरयेत्. In the next chapter the other Anjana yogas mentioned, and those Anjana yogas can also be used. With this, we conclude this chapter. This is Samhitayam Uttaratantrangate Shalakyatantre Drishtigatarogapratishedha Nama Saptadashodhyayah. With this, we conclude today. If there are any questions, like there are no questions, so we will wind up.